Okay, so let's talk about skilled physical therapy versus wellness because there's a lot of people who are physical therapists and they want to open up cash-based practices and they want to offer some sort of, medical fitness, maintenance program, wellness service and stuff like that. And they want to add this into their practice, but they're not sure how to really go about that. Are they allowed to do that being a PT? So this video is going to kind of go over that stuff for you. First step is if you're in a cash-based practice and you want to offer a wellness program, you're probably fine today. Your business can offer other services. Okay, so my first step, what I would recommend is clearly define what skilled PT is and what your wellness services or your medical fitness program or your maintenance program. So you have to write a policy that's going to clearly define what skilled physical therapy is based off of your practice act, and then show how your wellness program is going to be different compared to your skilled PT practice. Okay, then you'll have a policy on that. So you and your staff will know exactly what is what and which is skilled PT and what is medical fitness and stuff like that. Because what PTs are trying to do and what you can't do is you can't get around your direct access law or your practice act. And just by labeling treatment as a medical fitness or a wellness program to exclude the Practice Act or the limitations of direct access. So you're just going to call it a wellness program, but you're still going to deliver PT services. Because if something ever happened with that, you're going to be held in court to your highest degree. So if you're a doctor of physical therapy, you're going to be, is this skilled physical therapy or not? Okay, so if you clearly delegate or write a policy on what is skilled PT and what is our wellness program and how they're different, you can clearly show that this person was in the wellness program and they were receiving this, this, and this. And in my personal policy, it's more about the evaluation is skilled PT, dry needling is skilled PT, manipulation, advanced joint mobs, and clinical decision making are skilled PT services that we have to do as under our license. Everything else is medical fitness, wellness, stretching, and stuff like that. You have to create your own policy of what you will define it and what services are provided underneath each program. So that's if something happens and I have to go to court with that, and this person's and they're claiming that they were receiving PT, well, I can clearly show, well, this is the medical fitness program. Here's exactly what this is. This is what they were receiving. Here's my documentation to warrant that. They weren't receiving needling or any advanced stuff. And so be it, because you're always going to be held to your highest degree possible. So we're going to be held higher as a DBT or with a physical therapy degree. So that's step one. Two, you have to make sure that your client or your patient knows that they're in the medical fitness. So there has to be a clear communication. You establish the plan of care. You're doing skilled PT. They finish the plan of care. There's a discharge statement. And then this patient needs to clearly understand to avoid any problems that they're going into a medical fitness or a wellness program. So maybe even having a form to let the patient know that this is not skilled PT services. Your fee is going to be this. It's not reimbursable, and you're a part of the medical fitness program or the wellness program, whatever you want to call it. The big thing is, though, the main point of this video is you can't just call your services wellness services or medical fitness or maintenance services, just to get around laws and rules and regulations with our practice acts and direct access laws to get around that and just call it wellness. So my recommendations for you is write a policy on it, clearly differentiate between what are wellness services, what are PT services, have a policy written in place, and make sure that your patients and clients know which program they're actually in. And if you're going to transition people from one to the other, make sure that there's a clear delineation process of discharge, close the file, transition to wellness, and that the patient knows that they're in wellness. So I hope this clears it up a little bit. If you have any other questions, just click on the link below, and hope you enjoyed it. Thanks.